right, good afternoon, or actually good morning, everyone. It's actually a privilege for me to be here today. I'm very excited about this press conference. We have a number of different speakers today to talk about an incredible program, and once again, Santa Clara County is on the cutting edge and up front in terms of making sure that individuals that are incarcerated and under our care have the appropriate transitions of care to receive appropriate support in the community. So at this time, I would like to introduce Supervisor Susan Ellenberg, who is the president of our Board of Supervisors, to speak. Supervisor Ellenberg.
Thank you, Paul, and thank you all for being here today as we make an important announcement that will have a significant positive impact across our community. The mission of the CalAIM Medi-Cal Justice Initiative for individuals leaving custody is to ensure that the people who received care and services while they were in custody have the opportunity to seamlessly continue those services upon re-entry into their home community. This means that gains that were made while in custody through mental health services, drug addiction treatment, and support for chronic health conditions will not be lost when people leave custody. In short, this initiative will make these residents healthier and our entire community safer. This novel initiative provides new Medi-Cal benefits that support greater comprehensive planning for our residents who are returning to their home communities following time in jail or prison. We are very proud to be one of the first 3 counties, the others are Yuba and Inyo, in the state approved to begin this program, and of being the first county in the state to actually enroll the first individual into this benefit portal. Every county in the state must implement this initiative by October of 2025. But thanks to the great work of our county administration and staff, we have been able to go live a year earlier and deliver target sets of Medi-Cal services to people who arguably need them the most. It is critical that when formerly incarcerated individuals return to live and work in their home communities, they have the resources they need to succeed. That care often begins with custody health services, and the new initiative improves folks' likelihood of success in continuing care without gaps when they leave custody. This forward-thinking program can improve access to primary and preventative care, which are fundamental to optimal health. Further, this justice-involved reentry initiative will address equity gaps and improve health outcomes for people who are or have been incarcerated, a disproportionate number of whom are people of color. Pre-release benefits include comprehensive care management and coordination, physical and behavioral health consultations, lab and radiology services, medications and services for mental health and substance use disorders, community health worker services, and medications and durable medical equipment provided to the individual at the moment of release. I want to thank the county team that has worked so hard to get us here, and I look forward to learning about the lives that will be improved as a result of this program. Gracias por estar aquí hoy mientras hacemos un anuncio importante que tendrá un impacto positivo significativo en nuestra comunidad. La misión de la iniciativa CalAIM Medi-Cal para personas que salen de los servicios de salud en custodia es garantizar que las personas que recibieron atención y servicios mientras estaban bajo custodia tengan la oportunidad de continuar con éxito esos servicios y reingresar a la comunidad. Esto significó que los logros logrados mientras están bajo custodia a través de los servicios de salud mental, el tratamiento de la adicción a las drogas y el apoyo para las condiciones de salud crónicas no se perderán una vez que salgan de la custodia. En resumen, esta iniciativa hará que estados residentes estén más saludables y que toda nuestra comunidad esté más segura. Esta iniciativa de vanguardia brinda nuevos beneficios de Medi-Cal que respaldan nuestra planificación más amplia y íntegra para nuestros residentes que regresan a su comunidad de la origen después de un tiempo en la cárcel o prisión. Estamos orgullosos de ser uno de los primeros 3 condados, los otros son Uva y Eño, en el estado aprobados para comenzar este programa y de ser el primer condado en el estado en inscribir la primera persona en el portal de beneficios. Quiero agradecer al equipo de condado que trabaja tan duro para traernos hasta aquí y espero aprender sobre las vidas que mejoran como resultado de este programa. Muchísimas gracias.
Good morning, everyone. My name is Greta Hansen, and I'm the county's Chief Operating Officer. I'm delighted to be here with you today and have the opportunity to share with a number of leaders from the county the really exciting news about our work to expand access to Medi-Cal services and benefits for folks who are justice involved in our community. This is one of many efforts undertaken by the county to expand services for the folks who need them most. As Supervisor Ellenberg just shared, we know that a lot of the folks who come into county jail are really suffering. They're suffering from substance use, they're suffering from mental illness. Getting those folks back on track by giving them access to excellent healthcare benefits and services while they're in custody, and then making sure they stay on track by having those services continue when they return to the community is a critical opportunity to improve well-being in our community, to advance equity, and to increase public safety. And focusing on these prevention services, continuing the work that we've been doing, led by Supervisor Ellenberg and the rest of the board, to expand access to mental health and substance use for our community is critical. And making sure the transition is very smooth and effective for folks who've received substance use treatment and mental health in custody to continue that care out in the community advances all of our goals to solve some of the toughest problems facing our society. We are such a wonderful community. We have so many resources that other counties do not. And it is the goal of the county to really ensure high quality access to care and wellness for everyone in our community, and this is a major step forward in that effort. So I'll turn it over to one of my colleagues who can share more.
Good morning. My name is Dr. Cliff Wang, and I'm the Interim Director of Custody Health. We are excited to share this with the community, this opportunity of this new state program. The CalAIM Justice Involved initiative will support stabilization of chronic and significant health conditions, including mental health and substance use disorders across the continuum of care, and will facilitate a coordinated re-entry to support smoother transitions and improve public health and safety. Communities of color are disproportionately represented in carceral settings, and ensuring a better start for individuals departing our care is a vital step toward helping them return to the community and provide better opportunities for the future. At times, this is their first time receiving medical and mental health care in our setting, and the challenge is continuing that care after they leave. This program enhances our ability to do this, and we're really excited for this start. Thank you.
Morning, everybody. My name is Calle. I'm a Deputy County Executive with the County of Santa Clara. I have the privilege of supporting our behavioral health system and our reentry system, and really excited to be here with you this morning. Men and women, especially those with a serious mental illness who are trying to rebuild their lives, face many challenges, including housing instability, homelessness, and barriers to gainful employment. The county has long tried to address these issues by establishing reentry resource centers, faith-based reentry centers, by coupling behavioral health supports with housing services, by launching innovative employment programs like entrepreneurship training and peer counseling services. These programs and many others have been making a positive impact. For example, participants in Proposition 47 funded programs are less likely to recidivate, and our reentry network has tripled the employment rate for its participants. This CalAIM initiative is another step forward, and I'm proud that Santa Clara County is leading the way. Yes, a significant portion of this initiative is about medical and behavioral health services while people are in custody, but it's also about connecting people to reentry plans as early as possible. And in doing so, we're putting individuals on a path to rehabilitation, and now with treatment services providing reentry coordination and care planning. This initiative will amplify and augment the impactful programs already underway and create a more seamless continuum of care and more coordinated reentry system in Santa Clara County. Thank you.
Good morning. My name is Holly Child. I'm the Restorative Services Director for the Sheriff's Office. We're responsible for providing supports and services to people in custody and while they transition back into the community. Leaving incarceration is a difficult transition, especially for those with physical and mental health needs. Even short stays in jails can lead to job loss, housing instability, and worsen health conditions. In California, about 70% of people who are incarcerated have some form of health need, usually several needs simultaneously, emphasizing the importance of comprehensive care and support during and after incarceration. For many years, a federal exclusion policy prevented Medicaid from covering most of those who are incarcerated, complicating access to necessary health care. The California Advancing and Innovating Medi-Cal Justice Involved Initiative, or CalAIM for short, addresses this gap by enabling Medi-Cal funding for essential healthcare services for people both before release and once living and thriving in the community. The Sheriff's Office is thankful to the county and community partners working to advance this vital initiative that aims to boost and expand critical care to those in need. We are thankful to the advocates who worked hard to make CalAIM possible to help some of our most vulnerable citizens in our community. People in custody are someone's neighbor, friend, family, mothers, fathers, sons, and daughters. Consider Marcus, a 35-year-old man struggling with a mental health disorder and seeking stable employment to support his family. Or Jessica, a 26-year-old mother caught in a cycle of incarceration due to trauma and addiction, longing to create a better life for her children. Programs like CalAIM are designed to help people, like Marcus and Jessica, receive the care they need, promoting healthier and more stable lives. This initiative will transform health outcomes for those who are incarcerated and foster a system focused on health equity and rehabilitation. The Sheriff's Office sees this as an opportunity to keep people out of jails and prevent them from returning to one of our facilities, saving money and lives. While there is much work ahead, there is hope for change and safer communities for everyone.
Good morning. My name is Michelle De La Calle. I'm the Director of the Office of System Integration and Transformation for the Health System, and I've been working in collaboration with several other departments on this effort to implement and roll out CalAIM for the justice-involved population. The County of Santa Clara took a comprehensive and collaborative one-county approach to the CalAIM justice-involved initiative. High-level partnership was required across multiple county agencies, including those represented here today, and many others. Reentry into community is a high-risk period of time for a high-risk population. County jails need to be proactive in planning, as many releases occur without a known release time frame, complicating the ability to effectively plan. It is from a comprehensive one-county view that we approached this initiative and highlighted 3 key priorities to guide us in the planning, preparation, phased go-live, and anticipated full program rollout. Our 3 guiding priorities are 1, center the person, 2, streamline systems, and 3, anticipate release. By keeping the person in the center, we prioritize a person's goals to ensure their essential needs are addressed. If someone is concerned about food, for example, they will not likely prioritize getting their medications or following up with their doctor. To streamline systems, we must work together across agencies and reduce silos. With that, systems are easier to navigate, more efficient, and communication is enhanced to provide access to the right care for the people who need it the most. As we better anticipate release, we can set up that person and the system to provide prioritized support, increasing continuity of care and accessibility to the services they need. Behavioral health linkage and warm handoff to community service providers and the enhanced care management benefit are 2 additional components to the initiative, bringing accountability and continuity. With early identifications of persons who need connection to behavioral health services in community and a proactive handoff to secure continuity, there's increased likelihood of successful transitions into the community. This work is not simple, and it's not easy. It's required focused attention and diligence across all staff and partners in several county agencies and partners across the state. It is also not done. We continue to face the complex challenges of starting a new program head-on. We're learning in partnership with our county teams, the state, other counties, and most importantly, our patients as we embark on this cutting-edge journey. Thank you so much.
We'll now take a couple questions. We'll have some availability afterwards, especially in Spanish. Please identify who your question is for, and we'll start with KQED.
So let me just start by repeating the question. The question, as I understood it, was does the fact that folks will now be on Medi-Cal while they're getting close to release give us more resources and the ability to better support them when they leave custody? And the answer is definitely yes, in a couple different ways. One, it allows us to create service continuity planning while we're in custody, so we know who their care provider can be when they come out of custody through our broad array of services. It makes sure that they come out with the guarantee that they will have access to services regardless of their ability to pay, regardless of their employment status upon release. And it also increases the resources the county has to do that service provision both in the end of their time in custody and as they come out into the community, so that we can really robustly support that service transition and care. And the question was, does this increase our ability to provide better care and more care while they're in custody as well as when they come out? And the answer is definitely yes. We are striving and have been for a number of years to really increase the quality and quantity of care we're able to provide to folks in our custody. The additional resources and the seamless transition from service provision in custody and out of custody that this supports will absolutely help us in our endeavor to deliver better and more services to folks who are in our custody.
Thank you. The question is, why is it important that Santa Clara County is involved in this program? There are a couple of reasons that I would address. One is that we have historically overinvested far beyond our state required minimum in our mental and behavioral health services. We have made a priority across the county working to serve the population who needs serious mental health care and substance use disorder care. The justice-involved population has a significant overlap with that work, so consistent with our leadership in behavioral health, our leadership in reentry services, our leadership in trying to build a carceral system that is as least traumatizing as possible, as most rehabilitative as possible. This is consistent with that work, and very often we find ourselves being the first county to implement a program like this that is very, very justice and health focused, and I'm proud that we're at the vanguard again.
All right, thank you all for being here. We appreciate it. Thank you to our speakers for the time, and we'll be available for one-on-ones if you need quick follow-ups after. Thank you.